Hey, so I wanted to make this video to kind of outline the timeline that I went through for actually getting my top surgery. It's coming up soon in about 12 days. So now that we're nearing the end of it, I wanted to offer an idea of how long the process has been going on and the steps that I took to get where I am now. January of 2022, I am discussing with my therapist getting on testosterone, and I've been on T for a few weeks at this point. Eventually, I bring up the idea that I would like top surgery. So in Ontario, you do not need to be on testosterone to go and get top surgery. It's not a requirement that most places have. However, you do need a gender dysphoria diagnosis, which is specifically why I had to go through my therapist for this. He asked me some questions about where I wanted to get the surgery done, who I wanted my surgeon to be, the kind of procedure I was looking toward. These were all things that he had to put down on the form that he was sending into OHIP to request that the provincial government cover my top surgery fees. Since I wanted to go with a government-funded route, I didn't mind waiting a little bit longer for OHIP approval. So due to some unfortunate circumstances, I could no longer contact my therapist. Eventually, in October of 2022, when I got in contact with my new doctor, she checked and saw that my funding had been approved. So that was within 9 months. I don't know exactly when it was approved, how shortly after he sent in the request, but I do know that it was within a year, and after that point, I was good to seek surgery at a clinic since I had the funding. Since my funding was approved, I believe I had about 5 years to actually decide and go through with surgery since the date of the approval. Eventually, in January of 2023, I had a call with the clinic to set up a consultation of sorts. A lot of the top surgery process was me calling the clinic. It doesn't go through the doctor doesn't make the appointments for you. You have to call yourself to get the appointments. So I had this call to set up my consultation, and then they emailed me requesting some images of my chest from a few different angles. Eventually, my consultation date comes within the same month, and they want to discuss with me the different procedures that they could do based on the appearance of my chest in those images. At this point, the surgeon that I was having a call with recommended that I actually talk to a different surgeon since my chest was on the smaller side and could be a candidate for the periareolar approach as opposed to just DI. So the call ended, and I was told that I would be maybe getting a follow-up meeting. However, this never happened, and so I then called in October of 2023 to set up a new appointment with the surgeon that the previous surgeon had recommended that I speak to. I have my consultation with the surgeon that I'm actually getting surgery with, and she goes over the kind of options that I have. She explains to me that I'm borderline between the two in that she won't know until she actually sees my chest in person which method she'll actually want to go with for the day of surgery. During this call, we discussed setting up a date for surgery. When it came to actually picking a date for surgery, there were a few things I had to consider. I'm a university student, so I had to find a time in my schedule that would allow for me to take a few weeks off, and eventually we settled on a surgical date a few weeks after my last exams. Now that I had a date for surgery, the next steps were actually paying for the surgery. OHIP covers the actual procedure, but it doesn't cover the chest masculinization aspect of the procedure. And that has to do with the fact that it's a cosmetic application, which isn't covered when it comes to the top surgery. So the chest masculinization itself has to do with liposuction, and that's what I would be paying out of pocket for, since the surgery itself is covered by OHIP. So for me, this chest masculinization cost $3,500, and I had to put the deposit down of $875 by January in order to secure my date for surgery. My university luckily had a program that I was able to apply to in order to get funding for my trans-related healthcare, and that's how I was able to pay for the vast majority of my surgery expenses. If you're a student in post-secondary education, whether you go to a college or a university, I would definitely check to see if they have a program similar to this, wherein they offer either medical fee assistance or specifically gender affirmation funding. The full cost of my top surgery would have been due 2 weeks out from my actual surgery date. Now that I'd paid for my surgery, I received the surgical package. which basically outlines everything that I need to do before my preoperative appointment, as well as had the paperwork I would be signing the day of surgery, some post-care instructions, and the emergency contact information of my surgeon. So as a part of the surgical package, I had a blood test requisition that I had to print out and go and take during a very specific window of time. This was to ensure that my blood test results were as accurate as possible, while also making it to my preoperative appointment on time. Along with this, I had to see my doctor and request that she send over my client-patient profile, which is basically my medical history. And then I also needed to get the information for a pharmacy in order for them to fax over my narcotic prescription for after surgery. All of this I had to do before my preoperative appointment, because the day of my preoperative appointment, they would be faxing over the prescription for my medication, as well as going over all of my medical history and making sure that my blood test results meant that I could go forward with surgery. So the day of my preoperative appointment comes, April 4th, 2024, so about 22 days before my actual surgical date. At this preoperative appointment, they did things like take my blood pressure, check my heart rate and my blood oxygen levels, as well as go over my medical history in case there was anything that was missed in my client-patient profile. They also went over a little bit about how the actual day of surgery would go. So I was told to arrive 2 hours before my actual surgical time, and that the surgery itself would take about 2 to 3 hours. After that, the recovery period is only about an hour long, and then I'm free to go home and actually start my rest. Overall, it's taken about 2 years since the actual point of putting in the OHIP insurance request to my date of surgery. The process may have gone a bit faster had it not been for having to plan around specific things and losing contact with some doctors, but overall, I'm really pleased with how fast it's gone. I've never really felt like I've been waiting around. And if you have any questions about this topic, make sure to leave them below, and I look forward to seeing you around next time.